Do you know why patients behave the way they do? And if you're a healthcare personnel, have you heard that patient or patient relative beats up healthcare personnel? If you have not heard, I pray that you are not the next person. Say amen in my comment box. Yes, say amen. Alright, on this very video, we want to talk about what I call patient illness behavior or client illness behavior. On this very video, we are going to be explaining some of those possible reasons that would make patients or their relative behave the way they do. And at the same time, we are going to also talk about the advantage of having this very understanding. So let's dive into the discussion for the day. All right, first of all, what is patient illness behavior or client illness behavior? This simply put can be seen as those behaviors, those set of attitudes or attributes that will be displayed by healthcare seekers during the course of being attended to by healthcare providers. All right? So let me put it another way. Those set of attitudes, those set of behaviors that those who are sick, those who are ill, those who are unwell will put up while trying to get healthcare services. All those behaviors attempt illness, client illness behavior or patient illness behavior. I haven't understood this. What are those possible reasons why they behave the way they do? So I will not leave you in the dark. I'll start with the first one, which is their cognitive or perceptual factors. So when I talk about cognitive, I simply mean things around their beliefs, their attitude, their knowledge about their health and their illness. All right? It's also, when I talk about the perception, it also implies how the patient perceive their symptom and their health status. So the way the clients look at, view, the way they perceive their illness, their symptom, the understanding they have about it will determine the way they behave. All right? So what are we trying to say? We are saying that this particular perception includes the ability to recognize and describe their symptom. So it's one thing to recognize that this symptom is actually there, is there in that individual. And it's another thing for the individual to know the severity of this particular illness. Yes. So it's not just to know it's present, but how severe is it? And then what impact will this condition have on the individual? So where the client that seeks for healthcare services actually do not know that this illness is present, what do you expect? They won't take whatsoever you are saying serious. They won't at all. They won't. And then say you are actually, now from the cognitive aspect, you're actually telling them this condition have gone so far. They'll tell you, God forbid, because of their belief. Tell you, God forbid. So the patient understanding of this condition, their expectation from the treatment and so on, and how the ability for them to manage their symptom have a great role to play while they come in for service. So it's not unusual for you to hear the client deny the presence of an illness or do not believe that that illness is actually present. It's not unusual for them not to take their disease condition serious, their diagnosis serious. It's not unusual at all. It's one of those illness behavior or one of those behavior put forth by clients when they come seeking for healthcare services. All right, so that takes us to the second one, which is the judgment and evaluation. All right. Now, this is how the individual assesses the severity and the significance of their symptoms. All right. So this will fall around a lot of factors, which is culture, exposures, and so on. All right. So it's one thing for an individual to know a disease is present. It is actually another thing for the individual to know how significant is it to actually tackle this particular illness. So I've actually seen clients say they'll tell you this illness is not serious. I feel I can still go about my usual activities. I feel I can still do things, but I can still work now, but I can still let me just go home, I beg. I can't just come and sleep here. You get? So they don't really understand the significance of this very illness or this very healthcare service you are rendering to the severity of their illness. So the ability for them to make proper assessment is one thing. All right. So another one is the aspect of the action versus their exposure. So I've actually seen a client, just immediately he got pain relief. He actually requested to go home. And this is the same client that was bitten by a snake. So if you know how terrible different venom of snake could be, a client requested to go home because after receiving pain relief, he felt that was all. And he actually left the facility. So what are we saying? It is not unusual to see all these actions. It's not unusual to see them. So, but when the individual is exposed, for instance, education, have traveled, have flocked around people who are exposed, then it's not uncommon for them to seek healthcare services and to comply to the treatment. Some will say this tablet is too much, I beg. Some will say I don't like injections. Some will say I don't like tablets. And a couple of days. And sometimes you might see that compliance is actually expected. In fact, there is no therapy or therapist that will tell you that if you don't comply, you will get maximal response to the treatment. So, this patient, their exposure level determines the type of action they will portray. Yes. So, having understood this, it will take us to the next one, which is communication and language barrier. So, one, there is the medical jargon. So, your inability to break down those medical terminology to the understanding of the patient is an issue on its own. Coupled with the fact that not all clients can be able to express their symptoms, how they feel. Not all of them can actually express it. Not all of them can even ask questions about, for instance, where they need to give consent. Not all of them can even know how to ask the question. So, issues around expressing their consent is another aspect. So, what are we saying in essence? Communication is a major barrier in relation to how patients behave. Because the client can tell you, but he didn't tell me this. In fact, I've had a scenario where I asked a client, how are you feeling? Is there any complaint? That was a client who came for follow-up. Is there any complaint? Is everything okay? Do you have any complaint at all? After getting medication, they were about injecting him. He was like, he didn't want the injection. I said, but I asked you, is there any complaint? Have there been any complaints so far? Is there anything you want to let me know? He said that I didn't ask him, was there any complaint with his injection? You get? So, what is the difference between is there any complaint at all? Is there something you want to let me know? And is there any complaint with your injection? So, I don't know if you get. So some of these clients can't be that funny because they don't understand some of these terms. So if you can't explain it very well to them, they would also even have that aspect to trust what you are giving them. And at the same time, what do you expect of them where they can't even express how they feel? And you know that improper history, lack of sufficient history gathering will actually lead to either a wrong diagnosis or almost correct diagnosis. In fact, there's even nothing like almost correct diagnosis or near diagnosis because you'll be treating totally different from what is present. Thank God for the age where we have the labs that are well advanced to carry out some of those diagnostic tests. So it's only going to be lacking, or these services will be deficient in rural areas where some of these equipment are not available, these diagnostic equipment are not available to checkmate some of what the patients present and to know how severe they are. All right. So communication is one of the reasons why they tend to behave how they behave. The next one is the emotional factors that comes to play. See, it's actually highly expected for clients to behave in certain ways. It's highly expected. For instance, things like anxiety, denial, and depression is common as emotional expressions from clients. Where they will tell you, just as I said earlier, they can deny the presence of something you have done diagnostic tests to pick up. An instance, HIV, God forbid. Hepatitis, God forbid. So you get, they can actually deny them the presence of them. And because of this, compliance will be poor. You get, compliance will be poor. And some, despite how well you take time to psycho-educate them or health educate them, they still have that anxiety as to the outcome of their illness. You get? So these are some of the reasons why clients behave the way they do. What still is where they actually have that extended family. Well, what affects one affects all. Though you are trying to attend to all, please can you excuse me? Let me attend to the. Everybody wants to flog around. Everybody want to hear. Everyone at the same time. So it's another thing, especially in the African setting, where they are highly emotionally bonded and emotionally expressive. So these are some of the reasons why clients behave the way they do. The next one is the aspect of social factors. All right. Now, this centers around things such as social support, cultural background, and socioeconomic status. All right. This include the influence of family and friends, and beliefs and practices, and access to resource and healthcare system. Now, I could even add religion to this very social aspect because there are certain religion that doesn't accept blood transfusion, and there are certain that males don't attend to their females. There are certain that don't take certain medications. There are certain that don't eat egg, that don't take certain proteinous food. So what do you expect where the only recommendation are some of these options that is like a taboo to them? So these are some of the reasons why clients behave the way they do. So some will tell you things like, I have used herb. In fact, herb works better for me, and so on. So the social belief, the beliefs they have, their culture plays a major role in terms of or their religion too, in terms of the social aspect. The next one is environmental factor. Access to healthcare, work environment, and living situation is another major thing we should consider, which would include things such as availability of the healthcare services, the demands of work or school, and the physical and social environment. Excuse, it's one thing for the healthcare services to be available. It's another thing for it to be affordable. That's why I like the advent of primary healthcare services, because it looks at things such as availability, affordability, accessibility, and then effectiveness of these very services. So, what are we saying in essence? Where these services are not in close proximity, what do you expect from them? Medical or traditional services. That's where they will go first. Before they will now, when they now present, they are now presenting in the complicated phase of the illness. So the other one is the aspect of school and work, still under this environmental factor, where the individual is working and the work schedule is tight, or schooling. They'll tell you, I need to go and resume work. I need to go, I'm missing a lot in school. When you know there is need for extension of admission, you get? So some of this, they explains why clients behave the way they do. So imagine someone you know that discharging would be a form of threat or will lead to a relapse, and the client is bent on resuming his or her work. So at that point, whatever you're doing would not stop him, or it's just wasting your time. The next one we want to talk about is the aspect of the um, economic or financial factor. This one plays a role. It plays a role. I've seen the client who had a snake bite declined service on the grounds of finance. I've seen a couple of patients left, or including those who are not being attended to because of finance. Some who will not even go to the hospital because they know that they don't have sufficient money. Some will say, let me not go. I already know the bill is high before I'll be embarrassed, and so on. So what are we saying in essence? The financial aspect plays a major role. So a client will start, doesn't mind even pricing you down, especially in the African setting, pricing down healthcare services. Yes, because things are actually expensive and they can't keep up to the financial expectation for some of those healthcare services. And also continuously have high mortality rate relating to the aspect of financial factors. The next one have to do with dependency and high expectation. So most clients see their physician as a god. And what do you expect? You have to do everything. Immediately they have seen the physician, this illness should be going out immediately. Immediately. Ask me, most of those conditions had happened for a couple of months and they never brought the clients. Now that is at the end phase, they are here expecting the physician to perform magic. And what do you expect where these expectations they actually come short? That's where you hear they pity the physician. You killed my mom, you killed my this, you killed this and that. They accuse you of that, they get aggressive. They, in fact, all these actions that follows results from this very aspect of dependency and high expectation. Where a client comes and depends on all he say, he will not put in their initiative or anything. Doctor said, doctor said, nurse said, and so on. So the next one has to do with the aspect of preoccupations or preconceptions and the aspect of rumors. So especially where, in fact, there are clients that have tagged a particular healthcare center close to them that they are actually related with death of clients. They tag them that if you go to that place, you will die. Why not go to this particular place? So what do you expect where that is the only option they have? Maybe because your facility is a bit cheaper from the one they intended to go. So they become suspicious, highly paranoid of whatsoever you are doing with them. And some even spread the information or news of incompetency. So what do you expect? They won't trust you. You're just wasting your time. Whatever you're saying, they are looking at you with another eye. So the next one has to do with the aspect of we considering the merit or the advantage of having this understanding. Why is it necessary to understand this different behavior? One, it will help you to offer patient-centered care. Healthcare providers should consider patient unique experiences, their perspective and behaviors when developing treatment plan. So the next one has to do with effective communication. Healthcare providers should communicate clearly and emphatically to address patients' concern and promote adherence to treatment. So break down those medical terms, break them down to the understanding of your client. This is to enhance high effectiveness. The next one, which is addressing emotional needs. Healthcare providers should acknowledge and address their patient's emotional response to their health condition as time goes on, using some of this knowledge. All right. The last but not the least is that with this knowledge, help you in encouraging self-management. So healthcare providers should empower patients to take an active role in managing their health and symptoms. So they shouldn't just depend solely on the health practitioners. To some extent, which is why I would also give credit again to primary healthcare services. Because to some extent, it helps the individual to be independent. Yes, they show you, guide you on things you can do in the absence of the clinician or healthcare facility. So having said all this, I believe you have learned something new. And I believe that when you as a healthcare professional, you step to that particular office of yours and you see clients behave the way they do, you will not start wondering, clients are always clients, patients are always patient, relative are always relative, patient relative always behave this way. Know that a couple of things play roles, such as what we have mentioned, how they perceive that particular facility, their financial status, what their level of education is in terms of their exposure. All these things plays a role. Where there is no room for trust, there is bound to be a mistrust. So thank you so much for staying this long. I look forward to that moment where this particular channel becomes your most favorite click. Look forward to see you on the next video. Thank you.